Do you feel pressure or a bulge down there, especially after going to the bathroom or standing for a prolonged period of time? It might be a rectocele, and there's a lot that you can do to help yourself starting now. Today, we're going to be talking about a rectocele, including what it is and how to know if that's what you're suffering from, as well as common mistakes that actually make your rectocele worse. We'll finish up by talking about what you can do today, right now at home, to help improve and decrease the signs of your rectocele. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and I believe that movement is life and you deserve both. First up, what is a rectocele? A rectocele happens when the wall between the rectum and the vagina weakens and the rectum starts to bulge into the vagina. I have a model to show you what that looks like. So right here we have your pelvis. Okay, so these are your ilium. That's what people call your hip bone. On the back side is your sacrum. That's the heart-shaped bone that sits at the base of your spine. This is your spine. This is your sacrum. Pubic symphysis is in the front. All right, so this is the bottom of the pelvic floor, or where you would feel the bulging. And what happens is that there's a wall here in between the rectum and the vagina. And if the rectum is very full, it can actually bulge into the vagina. Now, when it starts to bulge out of the vagina, that's when people will start to feel it when they're washing down there. So you may be suffering with a rectocele and you're like, I don't feel anything when I'm washing down there. Or you may have an increased prolapse. And so you can actually feel that bulge outside on the pelvic floor, as opposed to just inside where you're having the rectum that's bulging into the vagina. Many women who are affected with the rectocele have either previously had children or have a history of chronic constipation, which causes increased stress to that wall in between the rectum and the vagina. It can also be caused directly by a pelvic floor weakness. In my experience, it's not the pelvic floor weakness that directly causes the rectocele. It can happen. It's just not what I commonly see in my practice. Most importantly, what I want to emphasize right now is this is way more common than you may feel like. I am suffering with a rectocele and I don't know anybody who has been suffering with it before. I want you to know that you're not alone. Although we don't talk about rectoceles very commonly in our society today, there's way more people who are affected by it than are willing to talk about it. All right, so what are the most common signs of a rectocele? As I mentioned, you may have that bulging that is coming through the pelvic floor, but most commonly you'll feel that bulging directly in the vagina. Or people may have a feeling of fullness that's either in the vagina or pressure that's into that pelvic floor. You may have a bulging sensation or even be able to feel a bulge if you insert your finger into your vagina. Many women have difficulty being able to pass stool, and they may have actually already learned that they have to put their finger into their vagina and press on that rectum in order to be able to have a complete bowel movement. Often your symptoms of a rectocele will worsen after straining or even at the end of the day just from being standing up and sitting and having gravity push on your head. And often women report that after they lay down, the symptoms of their rectocele do get better over time. Now, I will also say that if you are suffering with a really acute rectocele and that it's really painful, initially when you lay down, it actually may feel more painful initially. And I can't 100% explain that with a scientific way. What I can tell you of how I logic that in my head is that when you lay down, everything's actually going back to where it's supposed to be. And initially, that's really painful. Even though that's where it's supposed to be, it's spent all day somewhere it's not supposed to be. So when it goes back to where it's supposed to be, initially it's painful. And then it feels better. Again, don't hold me to that. I understand it's not scientific. It's just the way I logic it. So what makes a rectocele worse and what things should you avoid doing? Well, first off, we want to avoid straining during bowel movements. Constipation is a huge culprit for a rectocele. The next thing is I need you to avoid any heavy lifting. And this includes everything from weights to kids to laundry baskets. For right now, while you're healing, I need you to avoid high impact aerobic activities. This includes things like jumping and running And if you've recently had a baby and feel like you may be starting to get a rectocele, then you're going to want to avoid these activities until those symptoms decrease. One thing that makes a rectocele worse is chronic coughing. And if you are suffering with a cold or flu right now, you're like, how do you stop from coughing? I don't have a great answer for that one, but I do include it here because some people have told me, like, I just started having this problem after I had the flu last month. So chronic coughing can cause a rectocele. I'm afraid I don't have a good answer on what to do about it. And the thing that commonly makes it worse that you will find advice for all over YouTube is doing Kegel exercises. And friends, I am going to get up on my soapbox right now. If you have been diagnosed with a rectocele or you've self-diagnosed with a rectocele and you watched other videos and did Kegel exercises based on their recommendations and have felt like it has made your rectocele worse, well, yes, you are justified, and chances are pretty good that those Kegel exercises did make things worse. So here is your permission slip to stop doing Kegels for the rest of your life. Not only are they ineffective, they actually do make symptoms worse, particularly of a rectocele. Now, don't worry, I am going to give you an exercise that we'll link at the end of this video of the exercise that I recommend to do instead of Kegel exercises. If this content is helpful so far, please click that like button, drop a comment below, and don't forget to subscribe for more pelvic floor content posted every week. Okay, on to the important part. What can you do to help relieve your symptoms of a rectocele and actually help that rectocele to start healing? The first thing you're going to do is breathe and release. We want to do that deep diaphragmatic breathing. So the diaphragm is that muscle that's at the base of your rib. You want to make sure that you're using that to do that deep belly breathing or diaphragmatic breathing. Different people call it different things. We just want to make sure that we're activating that diaphragm while we're breathing. That will help to decrease the pressure in the abdominal cavity, which can help relieve some of the symptoms of a rectocele. And please don't try to hold your stomach in all the time. I know back in the 80s, right, everybody's all holding their stomach in and we were supposed to be about like that big overall. Well, ladies, you know what? We get to let go of that now at this point in our lives. Let that belly hang out for right now. It is going to help to decrease the pressure in the abdominal cavity, which will also decrease your symptoms of a rectocele. The second thing I need you to do is improve your bowel habits. It is very important, especially when you're suffering with a rectocele, to ensure that you are not suffering with constipation. Now, you may be saying that's easier said than done, and I do understand that's true, especially if you've suffered with chronic constipation your whole entire life. I cannot overemphasize the importance of making sure that you are not having to strain or push while you are trying to eliminate that stool. So you can try things like drinking more water. You need to be drinking a minimum of 80 ounces of water every single day, and more than that if you work out regularly. You need to make sure that you're eating enough fiber and equally not too much fiber. So I have heard of some people who eat way too much fiber and that actually causes things to get clogged up. And I've heard of people not eating enough fiber and then there's nothing to bind everything together. And I know that that is a very general recommendation. The problem is that number is very different for everybody. So you need to figure out the right amount of fiber for your body. Another thing that can be really helpful if you are trying to improve your ability to defecate is to use something like a squatty potty. This helps to bring your knees higher than your hips, which actually tilts your pelvis into that position and can make it easier for things to pass through. Remember, it's important to never strain and take your time. The third thing I need you to remember is that posture matters. So making sure that your head is on top of your shoulders and your shoulders are on top of your hips when you're sitting, feet are equally on the ground. As well, when you're standing, you want to make sure that your hips are on top of your feet. So everything is lined up. That keeps you in a neutral pelvis when you're standing or sitting. Now, another thing that can be really helpful is some gentle movements when you're sitting or standing for prolonged periods of time. So if you're standing, that may be just swaying side to side, which will help to relieve pressure and improve circulation. And the last thing we want to do is some gentle exercise. It's important to make sure that we are learning how to contract and relax all of the muscles involved. So this includes the pelvic floor, This includes the abdominals, the glutes, the low back muscles. So, doing things like deep breathing, as well as the exercise that I'm going to link at the end of this video, will help to teach those muscles how to relax as well as how to contract. If you're dealing with rectocele symptoms, please know that you are not alone and your body can heal. Movement is life, and your pelvic floor is part of that movement. If this video helped you, please click that like button. Don't forget to subscribe for more pelvic floor health related content, and I'm going to link you over to that video so you never have to do a Kegel again.